Hello, this is Dr. Gay from First Look MRI, and this is a 9-year-old male who has history of new onset of seizures. And so they did an MRI scan here to make sure there is no structural abnormality that would explain the seizures. Sometimes the brain is just completely normal, and sometimes there's a finding such as a tumor or infection that can cause that. And in this patient, they do have a finding. So if we look here on the left side, this is the left mesial temporal lobe where the hippocampal formation is. We see a little round or ovoid area of low signal. On this sequence, fluid looks like this, low in signal, so a small fluid collection. On this view, it's a coronal view, and this is the most sensitive view to look at the brain in patients who have seizures. We look really carefully at this region on the left and this region on the right. This is the hippocampal formation. And we see this tissue right here. We make sure it's normal in size, normal in volume, normal in signal. And we look right above it at the fissure here. This is called the choroid fissure above. This is completely normal. On this side, though, we see that the hippocampal formation is pushed downward. And instead of having a convex outer surface, it has a concave surface superiorly. And the little fluid collection here is pushing down on that. The hippocampal formation itself is normal in signal, but it looks like it's just getting compressed or has a little bit of mass effect by this little fluid collection. And this is a choroid fissure cyst, which is just a benign cyst. In a choroid fissure cyst, sometimes they're asymptomatic or oftentimes asymptomatic. We see them and wonder, gosh, could this be a problem? In a patient like this where they have a new onset of seizure and we see a little bit of mass effect, we assume that this is large enough now to be serving as etiology for a seizure. But a benign little fluid collection in the choroid fissure, producing mild mass effect on the left hippocampal formation, and again likely causing their seizure disorder. Thank you very much.